And welcome to another Mark Bishop Show. You know, nearly half of all women aged 40 plus who have mammograms are told they have dense breasts. Yet, many women don't know that having dense breasts can increase their risk of breast cancer. Dense breasts can also make cancer more difficult to detect on a mammogram, leading to missed or underdiagnosed cancers, which can contribute to breast cancer mortality. Bayer released new survey results that uncover gaps in knowledge among women with dense breasts, pointing to a greater need for education on this important women's health topic. And did you know that the risk for breast cancer can be 4 to 6 times higher for women with dense breasts rather than women with the least dense breasts? So it is Women's Health Week, and my very special guests are Dr. Pamela Habib, Director of U.S. Medical Affairs for Bayer Radiology, and Dr. David Schacht, Breast Radiologist at Northwestern Lynne Breast Center. Welcome to you both.
Thank you. It's great to be here.
Well, hopefully for my listeners, you'll shine a light on what women need to know about dense breasts, how breast density is detected, and its impact on breast cancer risk and future breast screenings, Doctor.
Absolutely. Thank you, Mark. I can start with, to answer your first question of what is breast density. I think a lot of women don't realize that it's not actually something that you can feel. And so the only way to determine how dense a woman's breasts are to look at a mammogram. And so the definition of what it actually means is that when you look at the mammogram, there is fatty tissue and what we call fibroglandular tissue. And that fibroglandular tissue is what creates a dense breast. The more glandular tissue you have, the more dense your breasts are. And so, as you mentioned, it's very common, and it's a normal finding, but nearly half of women age 40 or over do find out when they have a mammogram that they have dense breasts. And the reason why this is important are really there are two main reasons. And one is that the dense breasts actually make it harder to detect cancer on a mammogram. So because we have this white, dense tissue on a background of darker, fatty tissue, any cancer also appears white, and so it can get hidden if there's a lot of dense tissue. The other important reason to be aware of this is that we know that dense breasts actually increase the risk of getting breast cancer. And this is separate from not being able to see the cancer as well on a mammogram, but this is just an underlying reason, an underlying increased risk. So women with extremely dense breasts are 4 to 6 times more likely to develop breast cancer than women that do not have dense breasts.
Gee, I mean, has the pandemic impacted how women might be getting breast screenings, as an example?
Yeah, that's a great question, Mark, and it turns out to be absolutely true. Certainly in our practice at Northwestern, we saw that screening rates declined dramatically, especially early in the pandemic, and there have been a couple of different models run regarding what the effect for this might be. And so unfortunately, the models show that very likely there will be on the order of thousands of extra deaths related to breast cancer due to the pandemic. So for me, those models really highlight the importance of women, regardless of their breast density, starting with an annual screening mammogram, especially if they haven't had one the last few years due to the pandemic. And then considering in consultation with their doctor and with reference to information regarding their density that should be in their mammography report and in the patient letter they get sent home to them, making the decision kind of in a shared decision-making model of whether something beyond just mammograms would make sense for them as an individual.
Well, let me ask you this then, doctors. What questions should women with dense breasts ask their doctors?
I think the most important thing is just to have an open-ended conversation and discuss, I think the first thing is to discuss the other risk factors in addition to having dense breasts that you might have. And so your doctor should ask you about your family history, for example, your dietary, a number of different questions. And then based on that combination of all of the risk factors, the doctor can help determine whether additional screening might be warranted. And that leads me to the second question is, do I need additional supplemental screening in addition to my mammogram? And that's really a question that you can decide with your doctor based on the combination of risk factors that you might have.
Mm. Well, in this research, the new survey findings show that nearly 30% of women do not feel informed about how their breast density impacts their breast cancer risk and long-term breast cancer screening needs overall. And 24% of women say they were worried, 26% unsure of what to do next, and nearly 60% of women say they did not receive any resources when they were told about their breast density. And then you go on with 36% of women were told that no action is necessary. I mean, gee, how do you know? It must be a worrying thing overall, doctors, really.
It really is. I think the survey statistics that you mentioned really highlighted and confirmed that women are not informed, and they don't know, even when they know that they have dense breasts, they don't always know what to do, and they don't receive the right information. And so it's really important to just be aware and to have that conversation with the doctor. There are different guidelines out there that have certain recommendations. In certain women with dense breasts, for example, the certain guidelines may say that they should get another test, and that might be an ultrasound, that might be an MRI, depending on your history. But it's really having that conversation and opening up that line of communication so that going forward, when you do get your mammogram, it can always be considered whether you need additional testing.
Yes.
Mark, to that, I'd add too, that there's been a movement within the last couple of years at the national level to really mandate the way we as radiologists report, not only to our referring physicians in our medical report, but also in the lay letters that we as radiologists send to all of our patients to start the process of patient empowerment through informing them of this information. The next steps, of course, involve conversations between the patient and the referring doctors, and in many cases also the radiologist, so that the best decision for any individual patient can be made.
Yes, I noticed too in those, in that survey results, facts and figures, 26% were told that they should seek additional screening. And Dr. Habib touched on that a moment ago. Speaking of finding out and educational, before I forget, I really want to mention this site. Folks, www.understandyourdensity.com. It's all one sentence, understandyourdensity.com. Doctors, on that particular site, there's a lot of information, right? I mean, it's understandable. Everything's there really to do something and get started.
Exactly. So it is a very easy to navigate site. You can go there, take a quiz, find out how much you know about breast density, and learn fast along the way. So it's definitely user-friendly.
Okay, let me ask you this in closing. What questions should women with dense breasts ask their doctors?
Yeah, Mark, I think that's the heart of the issue is understanding what the referring physician and the patient value. And out of that value-based conversation, great decisions can be made for any individual patient as to whether it makes sense for her based on her medical history, based on her family history, based on her breast density, whether any of these additional tests that are increasingly shown to be of potential benefit make sense for her. And that's really an exciting time to be working in this branch of medicine.
Well, it is a critical week, ladies and gentlemen. Well, particularly women listeners, it's breast cancer during Women's Health Week, your week, shall we say, and wonderful advice from my guest this morning. Very fortunate to have on the Mark Bishop Show Dr. Pamela Habib, who's head of U.S. Medical Affairs at Bayer Radiology, and Dr. David Schacht, breast radiologist at Northwestern's Lynne Breast Center at Prentice Women's Hospital. You're doing a wonderful job, doctors. Thank you so much. I know you've got a lot of other interviews to get on with, but I wish you well during this week, and let's hope your message really gets across.
Thanks, Mark. Thanks for having us.
You're welcome. Goodbye now.